Good evening, and thank you for joining me. Today, we have a special episode. You know, I'm Dr. Renee with blackdoctor.org, and today we had, you just saw the Breathe TV that we have all the time on this platform. But today we have a special after show of the person that was featured on the show today. So, as you saw, we had Tameka on the show today, and so we are going to have a nice little chit chat with Tameka. Here she is. Hi. Hi. Thank you so much for joining us.
Thank you for inviting me here today.
Awesome sauce. So, Tameka, like I said, we just watched your episode. What a journey.
Yes. Long journey,
Long
incredible journey.
journey.
I learned a lot. I've learned a lot and I'm still learning on this journey. So yeah, it's been a wild one, but so fulfilling in a way, if you can understand that.
Yeah, I mean, Robin Roberts says you have to make your mess your message. And I think that you've done that very well because anyone that is diagnosed with cancer at 13, and then how old are you now?
I'm 42.
42, and to have it twice more. I mean, my goodness gracious.
Yeah.
Like you've lived more like with cancer than without.
Yes, I have. Yes, I have. This journey with cancer has been a long one, but I wouldn't change it, honestly. Like, I wouldn't change anything. It gets rough. I have my moments where I'm like, God, why? I don't want to do this. You know what I mean? But I would not change it for the world because I've learned so much and I found my purpose.
Yeah, yeah. And I know for a fact that you've helped so many people. Please tell us more about your book.
Oh, so my book is the story of my life and my journey, my life as a child and growing up, and some of the things that I had to go through as a child, including the cancer, the bone cancer, um, and navigating that as a child, 13, and being in middle school, and then going to high school afterwards, and then my journey as a mother and my journey as a mother a single mom diagnosed with breast cancer, my initial journey with breast cancer, and then the reoccurrence. So there's so much in there that I've packed in my story, called Evolving Soul. I don't know if you can see it here,
So
but
yeah, move it over though. Yeah, no, yep, that way. Yep, perfect. Yeah. Because your name was blocking it. So I just want to
oh
make sure.
yes.
Yeah.
So
Perfect.
yeah, this is my book. It's called Evolving Soul. I talk about my journey with breast cancer, my re-diagnosis, my relationship that I had at the time when I was initially diagnosed, and the downs, with being diagnosed, the ups with being diagnosed, and some of the things that I do in order to get through this journey, because it's not easy. I don't do it in my own strength. So, there's things that I do to help me get through it and to help my personal wellness, and there's, the self-care things that I share. So there's some pictures in here of my journey and of myself and my daughter, but it's filled with ups and downs, and people have told me, like, wow, like, I never knew these things about you. I never knew, you went through so much. I admire your strength, and I'm just glad that I was able to put it out there.
Yeah.
What is I've always known that I was supposed to write a book from when I was 13 with my initial journey. And I didn't take the time to do it until I was diagnosed with the metastatic breast cancer. So, but I think I was fearful of addressing those things because I wanted to put it behind me. But, God said, nah, you have to do what I've told you to do. So get
Right.
to it.
Right. And how old is your daughter?
My daughter is 16 now. So, majority of her life has been with me with cancer. So when I was initially diagnosed, she was 5,
Oh, wow.
going on 6.
Right. Yeah. Wow. And anybody that has any kind of sickness is like, oh, so were you worried about your daughter maybe having bone cancer?
I am,
Mhm.
like I was worried about my daughter having bone cancer and now being diagnosed with breast cancer. I'm worried about my daughter
And now
having breast cancer.
yeah.
Like I am, I'm not going to lie, like I'm fearful.
Hmm.
So, I've always been, I was telling my best friend yesterday, like I've always been a person to go to the doctor since my initial diagnosis at 13, because I was misdiagnosed for 6 months.
Right. Right.
And being misdiagnosed for 6 months and then them saying you have cancer was like, I knew something was wrong, but I didn't think it was
Yeah.
that. And so, when I get sick, I'm like at the doctor. I know they get tired of me. I'm calling them. I'm like, this is happening. I don't understand. But because I've done that, like I've been able to find the breast cancer. I've been able to find out that my cancer had metastasized. So I don't want to put any fear onto my daughter. I try my best not to, but I want to make sure that she's okay.
Yeah, definitely. So I'm sure she knows all about herself, breast exams and all that good stuff. Did you guys decide to do the genetic testing?
Not yet. So they have said they wanted to wait until she was older. So 17, 18-ish, they want to do the testing so that because her hormones and things like that
Right.
were changing. So they didn't want to do it too early. But they will do it once she's 17, 18 years old.
Okay. Okay. Now, did you happen to have a family history of breast cancer or any kind of cancer?
Cancer, yes. Not like it was like my great
Oh,
aunt,
yeah,
like
far.
far down in the line. But breast cancer, no. And I didn't have the gene. No one in my family. But what I was told was that I can start the gene. So that was like,
Wow. Okay.
whoa. So my daughter and her children,
Right.
will have to get tested.
Oh, wow. I wasn't aware of that. So that's an interesting. Wow. Who knew? But so like for your first breast cancer, how did you find that?
I was doing a self-exam. So
Oh,
I
okay.
found my first lump doing a self-exam, and I was like, this doesn't feel right. And so I went to work. I was a special education teacher and I co-taught. The other teacher was on the other side of the room. So we had like a
Spider. Yeah.
yeah, like that you close and open and all of that. And so when I got to work that morning, I said, listen, no funny business, but I need you to feel this because I need to make sure that I'm not tripping. I know how I can be. I know, So she said, sure. So we went into the bathroom and she felt the lump and she said, Tameka, you need to go see your doctor right away. And I made an appointment to see my gyno, and she felt it and said, I'm going to send you for a mammogram. I said, okay. So, in a sonogram,
Hmm.
ultrasound, I'm sorry.
Yeah.
And so she sent me for those things. And right away, like when the machine closed onto my left breast, there was fluid coming out of my nipple. Discharge out of my nipple, and I knew that at that moment it was breast cancer.
Wow.
And after the exam was finished, they said, "We want you to hold on. The radiologist wants to talk to. I mean, the radiologist wants to talk to you." I said, "Okay." So I went and waited in the waiting area, and they said, "I want you to come back and look at this." So they showed me the scan, and you could he she pointed to the tumor and she said, this is what I think is breast cancer. this is why I think it's breast cancer. The way that it looks, the way that it's shaped, all of that. And but she said, I can't diagnose you. Only a doctor can do that. But I wanted you to see this. I said, okay. My doctor called me and she said, I'm sending you to a breast surgeon. So he went over the scans and all of that with me and told me at that moment, you have breast cancer. So from there, it was just finding a plastic surgeon, finding my doctor at the time referred me to a hematology oncology doctor. And from that point on, it seemed like everything just went so fast because it had grown so rapidly at that moment.
Wow. And, you mentioned you're 42 now. So, most people don't start getting mammograms till they're 40. So how old were you when you diagnosed this?
31.
31. Wow, that is young.
Yeah. 13 with bone cancer and then 31.
Oh, you got some with 1s and 3s.
Right.
Oh my goodness.
Yeah.
But yeah, that is very important to note that thank goodness you were doing self-breast exams, because I'm not sure that anybody's insurance covers mammograms before 40 right now. So
no, not unless you have a history,
right,
in your family or something like that. No, they don't, and that's unfortunate because people are being diagnosed younger and younger,
particularly Black women,
especially Black women, and so with them saying no, we're not going to do, like, you have to push for it, and the insurances. You have to fight with the insurance for them to pay for it. It's such a mess. And it shouldn't be like that. Like, if we are seeing that the numbers are increasing, especially in Black women, then they should be offered to us younger.
Yep, I totally agree. And, they were seeing that with colon cancer. And then I guess enough white people, it happened too, because they changed the age to 45.
Yeah.
So insurance does cover it now at 45. You don't have to wait till 50. But I don't know what it's going to take for breast cancer. I have a friend, unfortunately, she's no longer with us, but she had the mammogram, and then her doctor wanted to do an MRI, I think it was, which is not the norm, but this is what her doctor wanted to do. And she fought and fought and fought with the insurance company.
It's ridiculous. Like, I've never had that issue with the insurance company. I think because I had great insurance both times. But it's just like, why? Why does someone have to fight for their life? You know what I mean?
Really?
Like, why? When they're paying for the insurance.
Right. Yeah, and the craziest part of it to me is that the doctor is saying this is what we need to do. It's not like you just said, well, I want to do this because I'm a hypochondriac or something. No. The doctor is saying this is what is necessary medically for us to get a firm diagnosis, treatment plan, etc. Right. And the insurance company sitting there with their hands tied like, no, we can't do anything. No, you really can. The doctor is saying that this is necessary.
Right. And it's like, oh, they have to write it a certain way and
special code. And I mean, God forbid it gets submitted with the wrong one. Then they're like, no. And it's just awful. I mean, they've got to figure out a way to fix the system.
It is.
And they make it harder for the wrong people. They make it harder for the sickest people. And it's like, somebody.
The longer the time.
That's what I say. Just like you said.
The harder it is to treat.
Time is not on our side with most diseases. And so you want to get this done rapidly. You do not want to be put in the pile and 5 weeks from now, someone calls you and says, oh, by the way, no, you need to take care of this now, not next week, not next month. And so my biggest gripe is that most of insurance companies are run by non-medical people, and that confuses me.
It's like, how can you run something you don't know anything about?
I just don't understand how the powers that be went to business school and not medical school.
Right.
And I that confuses me so, because I'm like, but you should have covered this.
Yeah. And even sometimes some doctors or, radiologists, they overlook things because when I was 13, I was misdiagnosed for 6 months. They
Yeah.
kept telling my mom I was having a growth spurt while my knee is getting bigger and bigger and I can't walk. I couldn't walk, I couldn't run, and I'm in pain, crying daily because of how much pain I was in. And by the time I went to get an x-ray, went to get an MRI, a CT, and then got my biopsy, the day that I got my biopsy, I was admitted in the hospital to start chemo because my tumor was the size of a baseball. 13 years old, being told, yeah, you're going to come and have a biopsy and go home. I have my best friends with me. They're with me at the hospital with my mom waiting for me. And then my mom is told while I'm in recovery, she has to stay here because she has to start chemo immediately. So my mom has to take my friends home. I don't even know this.
Right.
And then I wake up and I'm like, I'm ready to go.
Right. Where's my mom?
Like, where's my mom? Oh, you have to stay. Your mom's going to come back. She had to take your friends home. What do you mean? Like, what do you mean I have to stay here in this foreign place?
Right. Myself. Yeah.
By myself. It was, it's just ridiculous. The lack of care sometimes, and just like, you get some people who just overlook things because they're not, doing their job thoroughly.
Right. Right. But I'm glad that your mom kept pushing it.
Yes.
Because there are some people, unfortunately, like, well, the doctor said so.
Yes.
Yeah.
Because the doctor said, and being on this journey now, as a metastatic breast cancer patient, what I've learned is I am a part of my team.
Oh, yes.
And I didn't realize that for a very long time. I didn't realize, like, I had to stay.
Mm-hmm.
Like, and I don't think some people realize that. They just want to listen to the doctor
and
go with what the doctor says. Mm-hmm. And you don't have to do that. And I made the change when I was diagnosed as metastatic, because my doctor at the time was like, here, take these chemo pills, and that's that. Like, that's your treatment. And I'm like, whoa, wait a minute. We don't even know if it's the breast cancer. Like, he didn't do any scans. He didn't do anything. Like, I'm like, wait, how do we know it's connected? I mean, he did scans, but they couldn't get the biopsy done because they wanted to do a needle biopsy, and it was just horrible and painful because I had to be awake. And so they couldn't get enough tissue. So he was just like, well, we're just going to give you the pills. And I'm like, no, can we do it another way? Can we do the bone? Because it had metastasized to my collarbone. Can we biopsy the bone? No, I don't want to break it. What? Like, I just need to know that it's the breast cancer. We're not just treating me to be treating me. Mm-hmm. And when he said, like, I'm just going to give you these chemo pills and you just take this and, that'll be that. I was like, yeah, no, I think I'm going to go get a second opinion. And he said, well, that's fine, but nothing's going to change. Like, the results aren't going to change. And I was like, okay, but I'm going to get a second opinion. And I went and I found a team that was going to include me. And my team includes me in everything, every decision, everything. They educate me on what's happening. I'm just not left out in the dark or being told what to do. Now I'm being asked, should we go this route? You have these options. I'm being told I have options. And that's what I needed. I needed someone who's going to take my opinion into consideration, take my feelings into consideration, and the fact that I am too a part of the team.
Yeah, that is important. And also, I always say that especially when we're talking about, chemo and stuff like that, a lot of medicines have side effects, chemo being one of them. Mm-hmm. And there's a lot of different kinds of chemo out there. And so if you are taking a medication, I always say, if you are having a problem with that medication, the last thing you do is just stop taking the medication. What you do is have a conversation with your team and say, hey, this makes me feel like this, or this does this to me every time I take it. Because there is so many things now that they can go pick a different one that maybe doesn't affect that system and won't cause you to have that reaction. So it's really important that you do talk to your physicians. I mean, let me tell you, 99% of them have a patient portal now. Send a message in the portal. You don't have to sit on the phone on hold all day, every day, and keep calling and calling. Send a message in the portal. Most of them have someone reading those messages, and you'll get a response.
Yes.
So send a message in the portal. Be an active participant. Because when I tell you, if you're an active participant, they can't blow you away because you're right there. If you're somebody who's just not going to worry about it, well, they're going to recognize that you're that patient, and they're not going to worry about it either. They just going to write the script and keep it moving. Exactly. And that's not wrong. They're doing their job, but they only have so much time in a day. So if you're going to be one of those people that they don't have to keep, oh, what does this one need now? Then they're not going to worry about it. So you have to, just like when we went to college and they were like, you should sit in the front of the class and let the professor know who you are. That's what I'm saying. You could be the one sitting in the back and never say anything to
never say anything. Yeah.
You pass your class, great. Or you could be the active participant who's in front, asking questions, going to office hours, stuff like that. So that's all I'm saying is you just want to make sure you're an active member of the team and you're not just sitting there. Exactly. A good doctor is going to ask you, well, how is it going? Are you able to take your medication? So you tell them, no, I can't take this. It makes me feel terrible. I take it and it's just awful. Is there anything else we can do?
Yeah.
Let them know. They need to know.
Right.
So now going forward, now what do what's next and how are you now?
So now I am still metastatic for the most part. Things are stable. However, I have they have seen increase in the clavicle area.
Okay.
So the tissue surrounding my clavicle now has cancer cells. So they're increasing there and they're pushing down on the clavicle, and the clavicle itself already has cancer in it. So with that, I am having a lot of pain.
Oh.
So they're doing pain management in addition to trying to treat the cancer that has spread to the tissue. So now I have to have radiation.
Okay.
I'll begin that soon. I get my CT on Monday to begin that process. So, it's just what someone had described to me before was like being metastatic. It's just a leapfrog method, like you leaping from different treatment plans. So right now I'm leaping over here to radiation, which is my first time. I've never had radiation.
Okay. I was going to ask you that. Okay.
I've had chemo, been treated for the breast cancer or the bone cancer. I've never had radiation. So this is new for me. So I did ask a lot of questions, but the doctor was very thorough when he was explaining things. So I feel at ease. I feel comfortable. I feel seen. I feel heard. And so I'm ready to move forward with this journey.
That's wonderful. I think that every day is a gift, everyone. And, you need to, everyone should be very grateful when they wake up. But even when you do feel aches and pains, be grateful you feel them because that means you're still here.
You're still here. Yes.
Yeah, I woke up this morning and last night, I have severe asthma. And last night, I had all of a sudden out of nowhere at 9:00, I started having issues. And I was like, what is going on? So I made sure I had my breathing machine close by just in case I needed treatment. I'm single. I live alone. So I was like, okay, well, we, can't stop breathing, keep this together. So I took my inhaler and was like, okay. So I woke up this morning. 1, I woke up extremely late. 2, I woke up with a headache. So headache usually means that I have not been breathing in my sleep. So I was like, what is wrong with me? My head is killing me. But yeah, so my breathing is fine. And so I took some Aleve and was like, just get this headache gone and I can function today. But I'm grateful I woke up. And I didn't complain. I was like, okay, we know what to do. We got to just, and I, like I said, there's signs and symptoms. I know that this is a sign that we had a little issue yesterday.
Right.
And also, global warming has changed things drastically. So,
Drastically.
Chicago, it's supposed to be cold, but it's actually warming into spring weather in February, and it's not even February yet. So,
yes. Here.
And I mean, I was only outside for like 10 minutes yesterday, but maybe that was enough to get into my system. I don't know. Mm-hmm. We have this crazy haze. You can't see 2 feet in front of you.
Oh, wow.
So all these things, I'm sure, have done something, and that's what has caused my slight issue. Besides the fact that I worked really hard this week and have not had enough sleep. So put all that together, and, but like I said, every day is a gift, and I just, you just plug along, and, I tell everyone has something, you just don't know what it is.
Yep.
Yep.
Sometimes you don't know what it is. Sometimes it's triggered by something late in life or early in life, and it's always something with someone.
I think that kudos to you and to people like me. I think that we handle things, this is what we were given. Okay, we're going to make it work.
Right. I mean, I'm not going to lie. I have my moments where I'll be like, I don't want to do this. I'm having a moment. I don't want to do this. I just want to. And then it's like, okay, time to do it.
Yeah, exactly. I got really sick November of 2022. And everyone's like, you have COVID. I was like, I don't have COVID. I have asthma. The season changed. And I'm just having trouble breathing right now.
Right.
And I had to keep it moving. And of course, I was coughing and coughing. Like I said, everyone thought I had COVID. So I just wore a mask everywhere. But I had speaking engagements. And I still had to speak. And so, so I had
trouble breathing. Oh, no. That's hard.
And when they called my name, I said a prayer and was like, God, this would be a good time not to have a coughing fit. So,
right.
I had 20 minutes. And do you know, in that 20 minutes, I did not cough. As soon as I left here, I got again.
So but look at God.
That time I was groovy. But when I tell you, back at the hotel every night for the 3, I think I was in town for 2 or 3 nights, I woke myself out of sleep coughing. I was so miserable. I was taking breathing treatment after breathing treatment. And thankfully, I'm part of the team. I'm texting the doctor like, okay, so this is what I've taken. This is what I've taken. Is there anything else we can do? Because I drive myself insane. I need to get some rest.
Right.
And, but this, like I said, everyone has something. No one at the conference knew that I was not sleeping at night because I can't stop coughing and I'm wheezing.
Still pushing yourself.
Bingo. Exactly. So, you just do what you have to do and you keep it moving. I'm sure your daughter wants you to show up for her regardless of what's going on. So
exactly. I mean, she'll be like, no, it's okay, mommy. You can rest or whatever. But I know that she wants me there. So,
right.
There's times where I'm like pushing through and I'm just showing up at her games where she cheers and I'm cheering her on. I'm in pain, like, yay! So, it's just something that I have to do and something that, I realized that I've been placed on this earth for a purpose.
Right.
And my purpose is to share my story and to support other women and to advocate, in this space that I'm in now. So, like I said, it gets hard. I'm not going to lie. I'm not going to sit here and act like I don't have my moments.
Right.
But I know that there's a bigger purpose to this. And so I'm willing to go through it.
And thank God we don't look like what we've been through because you look fabulous. I see you threw on your lipstick today. I see.
I did. I gotta do a little something.
Right. I love the earrings, the bag. Yeah. So you.
Thank you.
Like I said, thank God we don't look like what we've been through. But kudos to you. I was telling my mom about you before we started, and I was like, "Can you imagine?" But it is so amazing, and thank you so much for all that you do. And I'm so excited about your book. Please, everyone, I've had it scrolling this whole time, evolvingsoulllc.com. Go to her website, buy her book. And
you can also just go straight to Amazon
and look it up
and get the book from Amazon. And again, it's called Evolving Soul.
On the other side. Yep.
By Tameka Johnson. And so, yeah.
And I'm going to put a link. I'll put a link to make certain that they have a link to your website and a link to purchase the book.
And also, if you have the My Life Matters
Magazine.
from Tiger Lily and Elephants and Tea, there's a link inside of here that you can use to purchase the book too. So, yeah.
Awesome sauce. Thank you so much for your time today. I love the artwork behind you, by the way.
Oh, thank you. I did a lot of these during COVID when the little sip and paint.
Yeah.
I did a lot of them during COVID with like my friends, my daughter. Me and my daughter did this one. The lion.
Yeah.
And then this one
I
did with friends.
Okay. Yep.
So, and then I have that back there. So yeah. I was like,
very
nice. Display my artwork in my office.
It looks fabulous. It looks fabulous.
Thank you so much.
Okay, so thank you so much. And everyone, we will see you again soon.